I'm Dr. Robert Suriani. I am the section director of the cardiothoracic division in our department, and I also serve as the co-coordinator of the main OR.
What led you to specialize in cardiac anesthesia?
When I was in residency, I liked cardiology and critical care, and doing cardiac anesthesia melded the two of them together. And I did a fellowship in that, and then came to St. Vincent's to spearhead the development of the cardiac program back then.
Why is it important to have cardiac anesthesiologists?
Well, it's important for the patient's sake. They deserve the best and a specialized care that is now part of the 21st century. Medicine and anesthesia requires people to be specialized in certain aspects of the field. You need to be able to do everything, but it is also good to be a specialist in one particular area.
What is your role in the Regional Anesthesia Fellowship?
My formal training in echocardiography allowed me to naturally convert over to the regional anesthesia techniques that are used now by our department in the Connecticut Orthopedic Institute. Having done echocardiography for the better part of my career, it was a natural outgrowth to join that team and lend my level of expertise to the program.
How have you and IAA changed since you first joined?
A lot has changed over the past 25 years. Our group has grown from 10 doctors to over 50, and then with the joining and creation of IAA, our group encompasses nearly 100 physicians at this point in time. There's been a lot of growth in many directions, and me personally in my career, I've gone from a cardiac anesthesiologist who does everything to one who has expanded in beyond the clinical realm into teaching at Quinnipiac University School of Medicine and teaching student nurse anesthetists.
Why do you believe continued training is important?
I've always felt that there's a lifelong commitment to learning when you're in medicine. It's not only the formal part that starts in medical school and residency and fellowship, but progresses throughout your career. Personally, through IAA, I've been able to expand all of that from being a student and new physician to a teacher and a member of the faculty at the Netter School of Medicine at Quinnipiac University. So there's a lot of opportunity for growth in many directions.
How does IAA support professional growth?
IAA offers a lot of opportunity for the new physician just out of residency or just at the beginning of their career. They can get as involved with clinical activities, teaching activities, research activities as they want. We offer a lot of opportunities for a great work-life balance. That's one of the most important parts of this group. You can be a clinician solely, you can be a researcher, you can find the balance that works for you and your personal life. And it can change over the course of your career, and it probably will.
What is your involvement in research?
I'm involved in both the research with the Connecticut Orthopedic Institute as well as research being done in the Heart and Vascular Institute. Specifically in cardiothoracic anesthesia, we're looking at perioperative pain management. We have a robust ERAS program. We are introducing regional pain blocks into the cardiothoracic patient for early extubation. And that goes beyond just the patient having cardiac surgery. We have a robust program in thoracic surgery where most of our patients come through the operation with minimal to no narcotic, and we have a lot of opioid sparing techniques. And this also carries over into non-cardiac surgery such as vascular and into the EP lab.
What would you say to someone considering joining IAA?
If you're thinking about joining IAA, I would highly recommend it. I would also suggest that you compare us to other programs if you're looking to come locally. We will compare with anyone. You have many opportunities to develop a career. Many people come here and they spend their entire career here. Many people come mid-career and wonder why they were not here earlier in their career. So we have a very big mix of people who spend their entire career here or come mid-career, and everyone is happy. There's a great balance of work and non-work that we can offer. There's a position for almost everyone's needs.
What are the people like at IAA?
Over the 25 years that I have been here, there's been many changes both in healthcare and within the hospital and within our group. But there's one thing that remains the same, and that is the people. The people are terrific. They're very diverse, but we share one thing in common: camaraderie and a desire to make our patients have the best outcomes that they possibly can.
What is the future of cardiac anesthesiology at IAA?
One of the most exciting parts for me in IAA is that our hospital plans to develop a new heart and vascular institute. Starting this fall of 2021 and into 2022, we are going to expand our cardiac ORs, our vascular ORs, our EP lab. We have a very robust structural heart program, and we are looking to expand. That means we will need to hire the best and the brightest of people in our cardiac program to move that forward and develop it within the Hartford healthcare system.
What is most rewarding about your job?
The most rewarding part of being a member of IAA is that I have developed friendships with a lot of different people, long-term friendships that I value not only now while I'm working, but I foresee carrying over into the years when I may not be at IAA.
What is most rewarding about being a cardiac anesthesiologist?
To me, one of the most rewarding parts of being a cardiac anesthesiologist is not only bringing the patient safely through the procedure, but during their post-operative visit, having them say to me, "Doctor, you alleviated all my fears. It was not as bad as I thought it would be. Thank you very much for all you've done for me."